intubation is called endotracheal intubation. Once you're asleep, your doctor will use an instrument called a laryngoscope. This device helps guide the endotracheal tube to its proper position. Your doctor will tilt your head back slightly and insert the laryngoscope through your mouth and down into your throat, taking special care to avoid contact with your teeth using a special blade on the device. Your doctor will gently raise the epiglottis, which is a flap of tissue protecting your larynx, as they advance the tip of the endotracheal tube into the trachea. Once the tube is in place, your doctor will inflate a small balloon surrounding the tube to make sure it remains snugly in place. They will then remove the laryngoscope and tape the tube to the corner of your mouth to prevent it from being jostled out of position. Your doctor will check to see that the tube is properly positioned in the lower part of the windpipe by inflating your lungs with a special bag and listening for breathing sounds on both sides of your chest. If the end of the tube is too low, both lungs will not receive the same amount of air. In some cases, an X-ray is taken immediately after intubation to confirm the placement of the tube. Once the endotracheal tube is in the proper position, your doctor will attach it to the mechanical ventilator, which will have a specially designed pump that aids respiration by delivering well-oxygenated air into the lungs and permitting carbon dioxide to escape. Levels of oxygen and carbon dioxide will be closely monitored to confirm that the ventilator is working properly. At the beginning of the outbreak, some hospitals were putting patients on ventilators early on in their treatment. This was due in part to concerns that less invasive ventilation procedures could cause viral particles to disperse into the air. With more cases of COVID-19 to study, health professionals are attempting to set guidelines for different types of respiratory failure and who ventilator treatment would be best suited for. This includes recommendations such as placing patients on their stomachs, called prone positioning, which evidence suggests helps increase the amount of oxygen that's getting to their lungs. So, with all this in mind, why does this virus cause only mild disease in most people but could turn fatal for you despite being healthy? In such a case, it seems the worst damage may be caused by an abnormal immune response to the infection rather than by the virus itself. In simplified terms, when any cell in your body senses that there is something foreign, in this case a virus, the immediate response of the cell is to kill itself, a protective mechanism to prevent it from spreading to other cells. The way this happens is that cells in your immune system, called macrophages, release small signaling proteins called cytokines. Certain kinds of these trigger cell death. When many cells are doing this at the same time, a lot of tissue can die. This is what medical professionals call a cytokine storm. In COVID-19, this means that lung tissue breaks down and the walls of the lungs' tiny air sacs leak fluid through, causing pneumonia and starving the blood of oxygen. Most of your cells in the tissue will die as a result of this uncontrolled level of cytokines. It eats away at your lungs to a point where they cannot recover. Your body is now attacking itself. Cytokine storms are becoming a common occurrence in COVID-19 patients with severe symptoms, and they seem to play a role in death in a large number of cases. Whether you would develop a cytokine storm may depend on genetic factors. Patients in studies with the H1N1 influenza virus who developed cytokine storm syndrome often possessed subtle genetic immune defects, resulting in the uncontrolled immune response. Now, you are more likely to have developed these genetic immune defects as you age, but there is also a small chance that you might have a genetic predisposition to developing cytokine storms after infection with the novel coronavirus. It's important to mention that the complete picture of cytokine storms is not yet well understood, and the medical community is still early in understanding the many aspects of the disease. A lot of findings and hypotheses need to be confirmed in more and larger clinical studies. But the good news is that many clinical trials are underway to explore treatments used for other conditions that could halt cytokine storms and fight COVID-19, as well as to develop new ones. There are currently hundreds of clinical trials of proposed COVID-19 drugs already recruiting patients. So, if you're lucky enough and make it through all this, you'll be weaned off the ventilator. You'll probably feel extremely exhausted, but you can now step down from critical care to a normal hospital ward, where you'll stay until you can maintain safe oxygen levels by just breathing air. After that, you can be discharged, go home, and be reunited with your loved ones.
لا تنسوا الاعجاب بالفيديو والاشتراك في القناة.